In our today's lecture, we will discuss about the beam restricting devices. Previously, we have discussed about the filters and their types, and we have also discussed about the grids. And we know that we use these devices to not only reduce the amount of radiation to reduce the patient dose, but we also use these to help improving our contrast. So the beam restricting devices also have these functions. They not only reduce the patient dose, but they also basically improve the contrast of your radiograph. But definitely when restricting the radiations, because they are made up of lead, so they will absorb your primary beam as well. So definitely you will have less radiations to reach the image receptor, and that's why it can degrade your image quality as well, and the contrast will be reduced. So the beam restricting devices, or today's lecture is all about the types of the beam restricting devices, and we will start with the introduction of the X-rays and the scatter radiation. So we know that our X-ray comes from the source, that is our X-ray tube, and after striking with our focal spot, we get radiations that are off focus as well, and they are also called the scatter radiations. And our primary beam that will, after interacting with the object, will go into the various direction, and it will also produce a scatter radiation. So the X-ray beam emerging from the tube head is composed of large numbers of photons that travels in a straight line in all directions. It is important to limit the size of the primary beam and prevent the exposure of the body region, which are not required in the image production. So the basic function to restrict your beam is to image only that part of the body that we are going to examine, and not the extra part of the anatomy being examined that is not required, and that is not being asked to include in the exam. So it will only provide the extra radiation dose to the patient, and will also degrade the image quality. So we restrict the beam by using the beam restricting devices, and we also do it through the collimation, and that is more applicable in the diagnostic radiology nowadays. Large X-ray fields result in unnecessary exposure, thus scatter radiation is increased and the image contrast is decreased. Beam restricting devices limit the field size to reduce the scatter and the primary radiation, because it's reducing the primary radiation as well, as I said earlier. So definitely it will reduce the contrast as well. So the overfocus radiation, those that are not striked on this focal spot, and they have interacted with the other areas of the target, so they will cause the off focus radiations, and they will also be considered as the scatter radiation. So the scatter radiation that can also arise from an object that in after interaction of the primary beam. So this scatter radiation we have already discussed many times. It will only produce the fogging of your image, and it will degrade your image contrast, and it is not useful, and it does not provide us any diagnostic information. So we try to limit the amount of scatter radiation by using various devices. So this secondary radiation arises from an object after interaction with the primary beam, and it totally depends on the composition of the body. If the body is thick, so definitely the area that you are going to examine is thick, so definitely there will be more scatter radiation. In diagnostic radiography, scatter radiation has no use. It makes unfavorable contribution to the formation of the X-ray image, and it seriously deteriorates contrast in the radiograph. So there are factors that we have already discussed many times that can increase the amount of scatter radiation, and these are the KVP, MAS, the field size, and the body habitus. By increasing the KVP and MAS, definitely you will increase the amount of radiation, and ultimately there will be more scattering. And if you are increasing the field size, once again you have large area, you are providing a large area, and there will be more amount of scatter radiation, and your contrast will be degraded badly. So always try, whenever you are performing your radiographic procedure, so always try to restrict by collimating it, by collimating the field of view. For example, if you have a lumbar spine procedure to be done, so just always try to restrict the spine and do not include the soft tissue, just only restrict it to the spine. Next is the thickness of the body part. So the thicker the part being examined, there will be more scatter radiation. So these are the factors that will cause more scattering. And now we will talk about the types of beam restrictive devices, and we have talked about the collimators already, and in our today's lecture we will discuss about the diaphragm apertures and cones and cylinders. Now they are not routinely used in the radiography, but yes, they have applications in various radiographic procedures. For example, the diaphragm apertures, we use them in dental procedures, in dental radiography, and we use them in trauma procedures as well. So first of all, we will talk about the diaphragm aperture, and the shape, you can see that there is a diaphragm in the center, and it will allow the or we can say that it is basically restricting the primary beam. And first of all, we will talk about the composition of the aperture diaphragm. So it is basically a lead or lead lined metal diaphragm that is attached to the X-ray tube head, and you can appreciate it in the diagram. And there is an opening, and the opening, basically you can see that it is restricting your primary beam, and on image receptor you receive an image that is 1 centimeter smaller on all sides than the image receptor itself, meaning your image receptor, the image that you will get on your image receptor will be 1 centimeter less or smaller than the actual size of the image receptor. So it is restricting your beam restricting devices, that is the aperture diaphragm. It is restricting the primary beam, and there will be 1 centimeter area unexposed on your image receptor. So there are the disadvantages associated with the use of diaphragm aperture as well. But before that, as I have told you that it has various clinical applications, and we use aperture diaphragm for the trauma radiography, and the typical trauma system has a fixed source to image receptor distance, and it is equipped with the diaphragm to accommodate various film sizes, and these can be 5 into 7 inches film, or it can be 8 into 10 inches and 10 into 12 inches. So it can accommodate various sizes of the film. And Another very important point is that you should take care to whenever the physicist will insert the aperture diaphragm into the X-ray tube head, and it should be placed like it should be parallel to the long axis of your image receptor, so that the primary beam can easily fall on the image receptor. Otherwise there will be an artifact that is called the cutoff, and it is associated not only with the diaphragm aperture, but it is also associated with the cylinder or cone. So basically आपके पास यहाँ पर जो आपकी एक्सरे की बीम है उसकी डेफिनेटली दैट विल नॉट कोइंसाइड प्रॉपरली विद द अपर्चर डायफ्राम. जो होल आपके पास आपके अपर्चर डायफ्राम में है उसके साथ प्रॉपरली कोइंसाइड नहीं करेगी, जिसकी वजह से आपके पास आपकी प्रॉपरली एक्सरे जो फॉल होनी है और आपको जो प्रॉपर इंफॉर्मेशन मिलनी है, जो एक्सरेज रीच करनी है इमेज रिसेप्टर के ऊपर, वो प्रॉपरली नहीं करेंगे एंड दे विल बी दी कट ऑफ, and that area would be left unexposed, and definitely you won't get enough information on your image. So that's very important to place it properly. And another application is the dental radiography, as I have told you earlier. So the disadvantages are that the size and the shape is fixed. It produced large penumbra. Penumbra is basically this is a shadow that is caused by an opaque object. So the disadvantage related to the diaphragm aperture is that it caused or it produced large penumbra. So because it can restrict the primary beam as well, it is restricting the primary beam as well. So जो आपके पास radiations reach करनी थी on the image receptor, जो transmit होनी थी, जो आपकी information वाली radiations थी, वो भी properly image receptor के ऊपर fall नहीं कर रही हैं, जिसकी वजह से आपके पास आपका contrast जो है वो भी उस इफ़ेक्ट हो रहा है. So there will be reduced sharpness and resolution. Next you have the cones and cylinders, and हमको दोनों को ही cones कहते हैं, but you can see the difference between their shapes. Cylinder आपके पास cylinder है, and the cone is the extended shape. और यहाँ पर आपके पास लेकिन कॉमन आपके पास जो एक पॉइंट है वो ये है कि जो प्राइमरी बीम आपको मिलेगी, जिस शेप में मिलेगी, दोनों में आपको सर्कुलर फॉर्म में बीम की शेप मिलेगी. सो दैट्स व्हाई वी कॉल देम कॉन्स. सो वन डिफ़िकल्टी with using the cone is alignment. If the X-ray source, cone and your image receptor are not aligned on the same axis, one side of the radiograph may not be exposed because the edge of the cone may interfere with the X-ray beam, just like we studied in the diaphragm. So there will be the cutting as well, just like in the diaphragm aperture. So we will call it the cone cutting. The same limitations that we apply to the aperture diaphragm. So we do not use the cones extensively in the diagnostic radiology nowadays, and we use them nowadays for the head and spine radiography. So the advantage associated with the cones and cylinders are that it has better restriction to the X-ray field. It produces less penumbra than the aperture diaphragm, and round image on a rectangular film, and it reduces the scatter radiation better as compared to the aperture diaphragm. So that's all for today, and If you have any question regarding this lecture, then you can ask. Thank you so much.